one of the dentists actually dropped a comment that I was like, this would make a great podcast. Basically, the post said, hey, here's how Dr. Blake Hamblin went from $200,000 a month in production to $500,000 a month in production in just 1 year span. He said that's not possible unless you are over treating and you're just way too aggressive with your treatment planning. So what do you think about that? Welcome back to another episode of My Dental Playbook. I'm your co-host, Gary Bird. Along with my friend, Dr. Blake Hamblin, we're going to be diving into over-treating. We recently had somebody tell us that you can only grow if you're over-treating, and Dr. Blake obviously doesn't agree with that, and he's going to dive into how he presents treatment and also the resources he uses to train his team. They're very, very useful and super simple. You're going to love this resource, and if you want to access it earlier, it's right down below. Stay tuned. All righty, we are live. Here we go. So recently we were posting online and a lot of nice dentists in there, a lot of nice comments, a lot of high fives. But as normal, there were some negative Nancy's in the comments. And one of the dentists actually dropped a comment that I was like, this would make a great podcast. And he said, basically, the post said, hey, here's how Dr. Blake Hamblin went from $200,000 a month in production to $500,000 a month in production in just 1 year span. So that's a growth like this. And he said, that's not possible unless you are over treating. He said, you can't do that. That's, you know, even with your two associates, that's over treating and you're just way too aggressive with your treatment planning. So what do you think about that? Like, what are your thoughts on that?
Yeah. I mean, that's definitely one way to grow. I don't think it's replicable. I think if you are known as the over aggressive dentist in your community, you're probably not going to have thousands of Google reviews or anything like that. And people, just like when you go to buy a car, you can smell the person that needs you to buy the car versus the one that just says, yeah, feel free to take whatever you want off the lot. And if you're interested, let me know. So I think, yes, you can grow by being over aggressive. I don't know that that's how we've done it. I think defining what is over aggressive might be helpful.
You said this, dentists are scared to tell patients what they actually need. And there's a middle road, right? So like for me, the non-clinical guy, when I'm talking to dentists that have never marketed before, I usually tell them like, hey, take the single tooth approach, like whatever the chief concern is, fix the chief concern. If it's multi-tooth, then fix multi-tooth. But the reason I tell dentists that is that I feel like there's almost like this, there's no middle ground, right? Like it's just like, you're either like, here, you got $50,000 worth of work of everything that I see in your mouth, or nope, everything looks good. Just come back to your next cleaning. You know what I mean? And there's like this no middle, there's no nuance to the conversation. And then just to steel man this from the other side, like what is over aggressive treating? I don't think dentists agree on that. So let me just like steel man it. If someone comes in and they have healthy teeth, let's say for me, and then someone says you should rip all those out and get all in four, we can all agree that that is too aggressive, right? So then where is that line then? Where does it start and finish? Or how do you think through it or train your doctors?
So this is nothing new. This isn't my idea. I got this from my mentor, Dr. Lathrop, who I mentioned in the post that some people may have seen. But one of the first things he ever told me was he pulled out a typodont, and dentists will know what a typodont is. It's basically just it's a model of perfect teeth. So if you were to think of a perfect front tooth, that's what it is. And he pulled it out and showed me, and I was like, what are you doing with this? We're not going back to dental school, right? And he's like, no. He's like, but this is what every patient could look like. And if they don't look like this, you need to, one, be trained to know how to get them to look like that, and two, be able to identify it. And so when I look at patients, literally, whether they've been in my practice for a day or 15 years, I look at them brand new every time. And I look at them and I say, do your teeth look like a typodont? And if they don't, then we can have a conversation about it. And so I think where the over aggressive, or I think a lot of that is internal, and it's how you reflect on yourself. I view myself as a guide. So like, I don't think I'm doing my job if I don't tell the patient all of their options. Like I don't know if Gary, if you want, your teeth to look like a Typodont or to be perfect, or if you're happy with the way they are without me asking and giving some options. So a lot of times I'll just say, hey, Gary, are you happy with your teeth? Everything feeling good? Have you ever thought about lengthening them? Does the length bother you at all? A lot of times this is accompanied with a big photo on a 75-inch TV in front of them. And a lot of times, honestly, they point at it and they're like, man, I've never noticed how short my teeth are. And I'll just look at them and say, yeah, if there was a way to fix that, would you be open to hearing about it? And then they start the conversation, not me.
Yeah, it's so interesting. This is such a fascinating conversation to me, and I love the cards that you're going to give us at the end of the show because I think it really helps the team. But the reason that it's fascinating to me is because I was like, oh, I got aligners a long time ago, and I was like, my teeth are straight, my smile looks great, and it wasn't until I started working with dentists and like people. I did it to myself. I post my picture online and they were like, your smile's jacked up. And I'm like, are you just being mean or are you being serious? And they're like, no. And they like gave me 500 things. And they were like, you bite your nails, you grind. And I'm like, dude, you guys are psychos. Like, how do you even see? And so now I'm like super self-conscious. Now I look at other people's teeth like a dentist. Like I look at it and I'm like, oh man, look at this guy. And so I've talked to you before about getting veneers and I know this is like a big topic is veneers, is that overtreating? You know what I mean? Where you're shaving down healthy teeth to put veneers on. Like, how do you work through that? How do you think through that side of it?
Yeah. So, I mean, there's literally courses that you can go to that are weeks long or multiple days long on this topic. So I don't think I'll answer it in 30 seconds or less, but like there's different things. So I call it a disease. I think a lot of dentists that have been trained in comprehensive dentistry would consider something that's called occlusal disease, which occlusion is just a big word for the way your teeth or your bite comes together. Occlusal disease is indeed a disease process. It's a slow disease. It happens over time. And so for someone like you who may have worn their teeth down over time, there's a lot of different things that factor into this, but a lot of these people have joint pain. They'll have headaches a lot. And so you can identify that. And by changing their bite to where it's back to the healthy position, the way that God made them, you now fix a problem they didn't even really know they had, or they thought they needed to be seeing some sort of neurologist for their migraines or whatever. And really all they needed were their teeth fixed. So it's defining what is disease and what are some options to fix it. And ultimately like the patient's in charge.
Yeah. So how much of this is, because it's very interesting. I've talked to dentists all over the world. So the one thing I would say about America is like patients are more apt to understand treatments like aligners where they go, this is actually going to be better for you. For me, my teeth were a little bit crowded down below and I would get a lot of plaque buildup there. I get a lot of plaque, like I have a really aggressive glands down there. So I get quick buildup. By getting aligners, it actually gave me healthier gums. My teeth are going to last longer. I feel better. They look better. Right. And now in a lot of other countries, they look at aligners like cosmetic surgery, almost like a butt lift or breast implants. They think of it that way, right? And so where do you draw the line? And I want to go to these flashcards because I think those are great. But where do you draw the line? Like at what point is it, hey, medically you need this, is going to improve your health. But then here, this is more of like cosmetic, which is another thing that people want if they want it, right? Like, where do you draw the line on that? Like, help me understand that from, again, keep in mind, I'm non-clinical. So like, where's the line on that?
So I'll lead with saying that probably 80% of the things that we as dentists do are elective. You don't need a filling. That filling could get bigger and turn into something different. And your choice is, do you want to solve the problem now when it's less expensive or later when it's more expensive? So a lot of the stuff that we recommend isn't a need. However, there are patients that are generally reactive and proactive. And again, I tell patients this, like I talk to patients this way. I say, there are reactive patients and there are proactive patients. My reactive patients, they wait until things break and they come in and they say, Doc, this thing broke. Can you fix it? And a lot of times we can. However, sometimes we can't. And it turns into more complex treatment like a root canal or an extraction with an implant. Today, if we fix it today, it would be a really simple fix by doing a crown or something along those lines. That's basically how I would phrase some of that stuff up. But the medically, again, it's like, what do you see? And that's where you'll talk to a dentist that is straight out of school and they only know general dentistry. It's like when you first started marketing, you only knew how to do like this tiny little subset of things. And it felt like you knew a lot, but until you learn all the other intricacies and the nuances of things
and how things impact each other, right? So like by you making this change, it's going to impact something else.
Yeah. So like you don't realize that tiny turn in the front of the tooth is the reason their bonding on the front chips off every 6 months.
But here, so let me push back on that a little bit. So it's not the young dentist online that say, hey, you're over treating and you're the problem, blah, 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 blah. It's always older dentists that have been around for like forever. Why is that? What are they, like if you were to still man their position, why are they stuck in that mindset or what are they missing?
Yeah, you're trying to get me in trouble.
I literally don't understand it. Like I don't understand like, okay, these people wanted treatment. You sold them treatment. They went and left a Google review and said how much they loved their smile. And then it's a dentist out there is like, no, you are scamming them. You're over treating them. Like, I don't even understand how you could come to that conclusion. Like, honestly.
Yeah. So I think like there's a reason there's like 4 different accepted philosophies of bite and occlusion. Like there's the Dawsons, the Pankeys, the Spears, like there's all these courses surrounded. In fact, I talked with Dr. Farrell about this yesterday. There's all these courses that are built around one person's philosophy. And I think dentists are really good at, we come in and we build our own philosophy of what dentistry should look like. And sometimes that philosophy is missing something and we don't know it's missing that. And so I think like there's been, number one is there's been so many changes and I'm going to be in this situation, 20 years from now to where what I'm doing now is going to feel like the right thing, but there's so many new changes that maybe I'm not even aware of. Right. And so I miss out on there's a gap in my understanding of what comprehensive, good quality treatment could be.
All the options. Yeah. You're just
bad treatment. There's new ways of doing it.
And also just to help me understand, that doesn't mean the dentistry that other person doing is bad. It might be excellent, like supremely good, but it's just, he hasn't bolted on 2 or 3 other options that he could present to people. Like another way to say it would be like, good is the enemy of great.
Yeah.
Right?
So like, is there anything wrong with putting a silver filling in somebody's mouth? No, absolutely not. Like you can do it. They did it for years, but there's new ways of doing it. You can use composite, you can 3D print it. There's so many new materials, but if you don't know about them, then you're kind of stuck in that lane and you can't change. And so therefore, and then once we're convicted by those things, we don't want to change them because that's our way. That's the way we've done it forever and it works. Right. So that would be my take on that.
Got it. Okay. So now one of the things that you do to train your team and to help you is objective training or objection training, right? And this is genius. So it's a flip card. And really on the phones or in the treatment coordinating, there's really only, which is interesting because, and I'm going to say the forbidden word in dental, those are your 2 sales positions, right? So front desk is your first sales position. They're always selling. They're always trying to, schedule people. And then and if you want to grow, you have to be good at that. And then your second sales position is your treatment coordinator. And there's about 5 to 10 main objections that you're going to get at the treatment coordinator level. And so something that you do with your team is you use flashcards. So it's like, here's the objection. And on the back, it has the solution to it. So do you got a couple of those you want to work through? And just for everybody listening, if you want the resource, it's down below. You can access that and get the free resource so you can train your team. But I want to go over the most important ones so you can kind of role play on how to actually do that.
Just trying to think off the top of my head is kind of tough. Do you have a situation that maybe you hear a lot and we can role play it?
I'm coming in for a cleaning. I generally have a healthy mouth, and you come in and I'm just getting my teeth cleaned. I had no plans of buying any other dentistry. How would you then work with me on telling me about aligners, needing aligners?
Yeah. So what I would do is I would come in and this is very nuanced. So I sit down in the chair and I purposefully sit a little bit further away than what I would if you and I were sitting next to each other having a conversation. So I intentionally sit further back from the patient when I first meet them. And I talk to them about, how'd you find us? What do you do for work? All that good stuff. And then, like I shared last time, I'll ask them, hey, do you mind if I lay you back and take a look around? They'll say yes. We'll look around. Prior to this, we've already taken an iTero scan, photos of their full face, up close of their teeth, all that stuff. We'll mention a few things that we need or that we see. And while I've got them laid back, I'll say, I'm noticing some crowding down here. Have you ever noticed that you've got, and I'm looking at the buildup that they have on the backside of their teeth. Have you ever noticed that you get a lot of buildup on the backside of your teeth? Oh my gosh, yeah. It's like I get my teeth cleaned and right away it comes right back. Oh, I know. Yeah, a lot of people deal with that problem, and I'll share with you some ideas of how maybe we can fix some of that here in a minute. And then, everything looks really good, Gary. It looks like you've done a really good job keeping everything generally pretty clean. I think keeping you on that normal 6-month recall is going to be great, blah, blah, blah. Well, let me sit you up. We'll kind of look at some photos here and go through everything. And then we have 75-inch TVs at the foot of the chair of each chair. And I went big for a reason because I was like, if I can put their picture really big in front of them, they can't ignore it. And so I'll quite literally put their picture up and ask them, is there anything that stands out in this photo to you? Not that bothers you, just is there anything that stands out? And a lot of times they'll say, yeah, the crowding on the bottom or whatever. And I'll say, just like I said earlier, is there if there was a way of fixing that, would you be interested in hearing more about that? And they'll say yes or no. And what I think we do a lot of times, and then here in a minute, I want you to give some pushback and I'll share how I do some of the eject. But a lot of times when the patient says, no, that doesn't bother me, that's where a lot of dentists will just stop. They'll say, okay. I say, okay, Gary, not a problem at all. I totally understand that's not a problem right now. If it ever becomes a problem, let us know. And I'd be happy to share some ideas of how we can fix it. So it's still a way for me to kind of tell them there's a way of fixing it without telling them.
Yeah. What are your thoughts on like working through that from what's going to happen if they don't fix it?
Yeah. So I think Chris Phelps has said this in the past, but people care more about what they stand to lose than what they stand to gain. And so I don't really tell them how amazing my filling's going to be or my implant or my crown. Like I said earlier, I always say something around the lines of, there's reactive and proactive, and I always end with what I want them to do. So my reactive patients, they wait and they come in, they say, Doc, that tooth that you talked about at my last clean, it finally broke, whatever. And all right, yeah, so let's fix it. And unfortunately, sometimes I've seen it to where they can break and they turn into more expensive and time-consuming dentistry like root canals and implants. But the good news is if we get to this soon, we can take care of it really simple and you avoid all the big problems down the road that you don't want to have.
Yeah, that's amazing. And then now let's work through the pushback. So probably the number one pushback that scares dentists the most is the finances. It usually manifests itself as usually people are like, well, how much is that?
Yeah. So anytime anybody brings up financing stuff or questions to me specifically, and again, this comes straight from some different masterminds and trainings that I've had, I go to the 4 promises, and this is from T-Bone and Sully. And I literally say, hey, Gary, I totally understand. What I want you to know is that today you're going to leave knowing exactly what we can do, how long it'll take, what it'll cost, and how you can pay for it. At the end of the day, these are your teeth. You can do some, none, or all of this treatment. Paige or Chi is going to come in, go through all this stuff with you. If you have any questions, let them know. They're literally here to fit this dentistry into your budget and your lifestyle. So work with them to help you do that.
Yeah. And let me give dentists, because I know a lot of dentists are scared of this conversation. Something that I learned about anything revolving around money. someone asking how much something is a buying signal.
100%.
Okay. It's not a denial signal. If they don't ask how much it is, that's actually a bad sign. So you want people asking how much it is. And what you guys are really good at is you guys already come in with the menu of pricing of different levels, right? So that's probably the biggest thing. What's some of the other objections that would you say would fall behind financing?
I think specifically around financing, we get a lot because we're out of network. So the question is like, how much does my insurance cover, or does my insurance cover any of this or any of that stuff?
So insurance coverage, yeah, that's a big one, because that is another way of, it's another price question, right? Like, how much does my insurance cover? Do you beat up people on their insurance beforehand? Meaning, one thing that I work really hard on is like, when we're working with a client, we tell them, hey, sometimes when we're setting up your Facebook or your Google ads, sometimes we get it up right away and we start getting results like the same day. Sometimes Google will delay it. Nothing we can do about it. It's just Google being Google. And so we push that blame onto Google. I don't know if Google's going to do that. You know what I mean? Or it might be other complications in there as well, but I'm not going to explain all that because it's just like very technical. But it's like, I explain ahead of time that there's might be problems and I make Google the bad guy. Do you guys precede some of that bad guy?
For sure. Yeah. So something dentists get really frustrated with are those silver fillings that have hairline cracks in them, and they know. And again, a lot of this comes down to philosophy. Some of these dentists are going to put a big filling in there. I personally believe that they're going to spend less money and less time in a dental chair if we just put a crown on it. Now, there silver fillings that I've replaced with regular tooth colored fillings? Absolutely. But a lot of times those crack lines go further than you think. And I will straight up, I love handling objections before they're objections. So I will straight up say, hey, Gary, I'll have the photo up on the screen. You can see these crack lines. Those look scary, right? Yeah, absolutely. Okay. I'm going to tell you right now, your insurance is going to fight us tooth and nail about this thing. They're not going to want to pay for it. But I'm going to tell you one thing. One thing we do in our office is we take photos of everything that we do. And as I go through this, I'm going to take all the photos in the world that I can take to make sure that we can provide all the data and all the information to your insurance company so we can help fight this. But I want you to know they're going to fight us on this. So there's a chance they might not help with this, but I want you to know that this is the right treatment for you.
So then you can go into all the financial conversation, but you beat them to the punch, because so many people want to avoid this conversation altogether. But if you just beat them to the punch, if the insurance covers it, it's like, the insurance covered it, let's go. And they're so happy. And if it doesn't, they're like, oh, that stinks. You told me that, right? So now, same thing. Like, if a dentist comes on with us and it's like, hey, it's going to take some time. It might take some time because the bad guys over here, they might drag their feet. So it might take 2 weeks, but we get it up in 2 days now. And they're like, oh, it's working 2 days in. And now, so you're over delivering, right? Like, that's so important.
I want to avoid getting 1-star reviews. And yes, like, you can go look us up. We have 1-star reviews. Like, they exist. But if you want to avoid more of them, handle this on the front end. If you handle it on the front end, it's not an excuse. If you handle it on the back end, it's an excuse.
Yeah. What do you think? I've heard people use the phrase before, we don't treat the insurance, we treat the patient. So we're always going to put what's best for your overall oral health first and foremost. And then we sort out all the insurance stuff second, because insurances are insurances, and everybody kind of knows what that means, right? Like, you don't have to explain that or educate anybody on what's going on with insurances. So do you like that phrasing, or do you guys use different phrasing?
And I think when earlier you mentioned something that I said about dentists maybe being afraid to like present everything that the patient needs. And I believe a lot of it is that over the years we know how expensive dentistry can be. And then we kind of generally know, like, we don't know all the ins and outs, but we generally know, okay, if they need 2 crowns, insurance might not pay for all that. But if they need 1, it's going to be reasonable for the patient. And so a lot of our like philosophies center around insurance and what insurance will cover. Well, that's the problem with medicine. Like medicine is dictated by insurance, that the hospitals are owned by the insurance companies. And so like, we don't even realize what we've done and like over treatment has now turned into, well, you diagnosed 2 crowns instead of 1. It's like, well, yeah, they needed that. You're just upset because their insurance isn't going to pay for it. And that's not our problem. Like if we would stop going and network with them and engaging in this stuff, they would stop doing all the stuff they're doing. But because we just lean over for them, they do it.
And not just that, but I always remind dentists of this because people press me on this, and I'm like, dude, I wouldn't be in network with insurances if I was a dentist. And I want you to remember this: who talks to the patient more, the insurance companies or the dental office? It's the dental offices by a lot. Sometimes people never have talked to their insurance company.
They have pushed all the problems on the dental office and they deal with none of
it. But the beautiful thing about it is you control the narrative as the dentist. The insurance company's never going to talk to this patient, or very unlikely to talk to this patient. So you get 100% talk time versus the other guy doesn't get any talk time. If you can't manage that relationship, that's on you. Like you haven't planned ahead of that. That's the first thing. The second thing is, and this makes me sick to my stomach, the first question every dental office asks every single time new patient calls, do you have insurance? Why is everybody so insurance focused? Bro, the first question, you didn't even get their name.
We talked about this yesterday in the huddle. We did a role play, and I was trying to give the example of the first thing that you've got to do is say, absolutely, Gary, how does Tuesday at 8 p.m. work for you? Don't even worry about let them bring up the insurance. But if you bring up insurance, all the questions after that are going to be about insurance.
Because you made it about insurance.
Yeah, well, because you didn't lead. Yeah, you led the conversation, but you led it the wrong way.
Yeah, you led it down the road that you don't want to go down. But I get it why dentists do that. Dentists go to the front desk and go, if this insurance or this insurance or this insurance, I hate them and don't ever let them into our practice. So they go, oh, we screened out 3 or 4, but also you made everybody else think about it as they were coming in and made it the primary issue, like the main thing. And then you wonder why everybody's focusing on it. If every dental office just stopped asking that and just started telling people like, hey, we don't treat insurances. We treat the patient first, and we take some insurances, some we don't, but if you're looking for somebody who's just going to prioritize your oral health, that's us. Patient's attitude would change overnight.
Yeah, no, I 100% agree. Like we are the creators of most of our problems.
Yeah, it's fascinating. All right, anything else you want to go over in this one? This is a really good episode, very powerful.
Man, I'm just trying to think of other objections that pop up a lot.
I think those are the main ones. If you solve financing, if you solve the cost and the insurance, like if you nail those two, that's 80%.
Let's talk about this because I feel like we get this a lot. Is we'll present something to the patient and they may say, hey, this is all great. I need to talk to someone about that. What we do in our office is
by the way, that's a smokescreen. No one really, almost never does anybody really need to talk to anybody else. We call that a smokescreen. And what that means is they don't want to tell there's another underlining problem, usually cost, that they don't want to tell you. So it's a nice way to say no.
Yeah, for sure. And so what we'll usually ask them is something along the lines of, okay, is there any questions about the plan that you need to be able to feel comfortable going home and talking to your husband about this or whatever? Or when we start to sense the fact that they're overwhelmed, right? So maybe we're presenting a lot of treatment and we're like, we can see it in their face or their body language changes. Then often what I'm still working with my treatment coordinators on this, is we'll switch from trying to close treatment to trying to close a plan, what we call a planning visit. So, hey, Gary, I totally understand that you need to talk to your wife about this. Would next Tuesday work to get you both back in here so we can kind of review everything together and answer all the questions you have? So we switch from, let's close them on saying yes to treatment to now they're saying yes to just coming back so we can talk to them. The hardest thing you can do is try to close somebody or try to talk to them about the dentistry that they need over the phone. Like the easiest thing they can do is just hang up.
Yeah. So the one little trick that I've learned that works really well is prior to presenting any numbers, you ask them if there's anybody else who participates in their medical decisions, which is important, right? Like especially for young people that are coming in, like maybe 22, and it's like they're an adult, but they might need help paying for aligners or veneers or whatever, right? And so it's like, hey, is there anybody else who, is involved in this? So that's one way to get ahead of it. The other thing is just to say, that's awesome. I highly recommend that you talk to them about this. What do you think that some of their questions are going to be around it? And what you'll get is you're actually going to get their questions that they're going to have, and they'll always give them to you, always. And so that's a great way to like get those questions out. And you'll notice it's mainly usually pricing or like, yeah, how am I going to afford it? And then so great, let me help you with that. And so that way you're ready to have that conversation with your husband or your wife or your mom.
Talking about this prior to starting the podcast, but like you've got to become a master of about 10 to 15 problems. And really everything else just revolves around that. And you can add nuances and kind of move and rotate. But if you generally know how to answer these 15 or so things, it's really
easy. Like those three things that we just covered is the majority of objections, but then there's the nuance of how to work through them. So if you want those cards that Dr. Blake uses to train his team, they're right down below. Let us know. Also, leave us a review or leave us a comment. Tell us, do we suck? Are we great? We want to hear from you, and we want to know what to talk about. So just so you guys know, like we have this long list of like hundreds of things that we want to talk about, but we'd much rather talk about the things that are going to help you and help your practice and where you're stuck and what you're going through. So if you have those things, let us know and we'll definitely talk about them. And thanks so much for your time today and always just being so helpful to everybody, Dr. Blake.
Absolutely. Peace.